Meanwhile, experts have said that India is presently in stage 2 of the coronavirus outbreak. The Indian Council of Medical Research has said that efforts are now being made to halt the disease's progression to the next phase, and that the country has a 30-day window to ensure that we do not enter into the stage 3 of the outbreak. The government has already taken measures like banning international travel to contain the outbreak. In the second phase, the transmission is limited to those with a travel history to the virus-hit nations, and travellers returning from the COVID-19 hotbeds have been asked to compulsorily quarantine themselves. If a person tests positive, then his contacts should be traced and put in isolation as per medical protocol. Mass gatherings have also been stopped to contain the spread of the disease, and people have been advised to observe hygiene practices such as washing hands regularly. India is also improving its health infrastructure to battle the epidemic. Testing facilities and isolation wards have been set up across the country.
ये प्रिकॉशन तो बहुत बेटर रहेगा क्योंकि हम लोग उस स्टेज में एक चांस है कि हम लोग उस स्टेज में ना जाएं, इसलिए थोड़ा सा so that's to prevent that stage to go into stage 3, which has happened in all the places. In Italy and USA is also in community transmission now. China you have already seen. UK is also now in community transmission. So and the whole of Europe is getting into that phase. So इसलिए हम लोग को लग रहा है कि हम लोग वो स्टेज से जाएंगे ज़रूर, मगर अगर प्रिवेंट कर सकते हैं, that window of opportunity is now.
All right, so that is what the experts are saying, that the window of opportunity for India is now. It is a 30-day window that India has to ensure that the virus does not spread widely. So let's also tell you that a pandemic generally has 4 stages. Listen in to know as to how it actually spreads from one stage to the next.
Broader perspective, I would like to all of you to understand. One thing is that there are stages of this disease. So stage 1 is imported cases, and that is what we have got in India, stage 1. Stage 2 is local transmission. That we have demonstrated also has happened in India, which has happened in the case of the Agra, which were brought to Safdarjung, this 5-6 family members, and also in Kerala in 1 or 2 places. So there have been three incidents of local transmission. So up till stage 2, we are not that much worried, and we are in stage 2. Then comes stage 3, where there is community transmission, and certain communities will be affected, in a large areas will be affected, and that will be worrisome. And the 4th stage is the epidemic stage, and that is the stage where Italy and China did a lockdown. They did not do it at stage 2 or even at stage 3. They did it at stage 4.
Meanwhile, the health body has assured people that India has enough equipment and facilities to carry out coronavirus tests. The country has about 51 testing labs where 90 samples are being tested daily. Now, India has the overall capacity to test as many as about 4,590 samples in a day. In fact, the body has said that there's only 1.3% utilization of labs at the present moment, and the current infection rate in India is just about 1 to 2%.